This is the Greek god Priapus, and this is a Brazilian wandering spider. I promise the two are related. Depending on who you ask, the Brazilian wandering spider is either the 8th or 3rd most venomous spider in the world, but it's not the deadly side effects of its venom that we're interested in today. One of the more dangerous side effects of this spider's venom is a condition called priapism. Now, you've heard priapism described at the end of every ED medication commercial, an excitement lasting for more than 4 hours. So an excitement is caused by the stimulation of both nerves and blood vessels inside the wingdang doodle. On each side of the doodle, there is a chamber called a cavernosa, and each chamber has a one-way valve placed at the top. The chambers are connected to each other so they can equalize pressure. The venom of the Brazilian wandering spider induces a nitrous oxide reaction in our bodies. Nitrous oxide causes a dilation of certain blood vessels, allowing the doodle to become engorged without external stimulation. Now, the purpose of these valves is to keep the blood in there for the duration of need, but the danger comes when you keep in mind that this blood is entering but not leaving. After 4 hours, the blood no longer contains oxygen and may begin to clot. Seriously, you need to make a decision right now if you want to continue watching this video. When blood clots in that part of the body, there is no pleasant way to resolve it. After a certain amount of time, even if you are able to open the valves at the top, the blood inside has reached a consistency of grape jelly and can no longer leave. The first treatment here involves using a syringe and a needle to lance the cavernosa to drain them of their content. Now, fortunately, because the cavernosa are attached, relieving pressure from one side will relieve pressure from both sides. Unfortunately, because of the sensitivity of the area, the urologist who was speaking on this topic said that they don't use local anesthesia because that involves just sticking a needle in there more times. They then irrigate the cavernosa with saline. Unfortunately, if the condition that caused the priapism is still present, the condition can return within minutes after draining. In that case, the next step involves a scalpel, and it looks like this. Well, I hope that was both informative and terrifying. Remember, when it comes to priapism, prevention is key, so the next time you're on a jungle adventure in Brazil, maybe think twice before shaking hands with any spiders.